Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Thomas Cziao. Dr. Cziao is a biological and functional dentist who practices whole body dentistry in Seattle, Washington. His journey in biological dentistry started when he came across functional approach of healing when searching for the cause and cure of uncommon allergies and health issues his wife had developed. Being board certified in Integrative Biological Dental Medicine and an accredited IAOMT member, Dr. Cziao combines his knowledge in biological approach with newest research and techniques available. This allows him to create personalized treatments based on understanding and respecting each patient's difference in health and physical conditions. He aims to lower or even eliminate the negative impact dental treatments and materials can have on the human body in the long run. And I'm so glad to have you here today. Thanks for being here, Dr. Cziao.
Thank you for having me here.
Yeah. So we kind of hinted a little bit to it in your bio there, but I always like to start off with figuring out just what's your backstory? How did you get involved in this? So if you can kind of add on to what we said in that bio there.
Yeah, so in dental school, it's basically everybody's trained the same, not in a biological way. But after the dental school, after my wife had started working for a bit, she did develop all those uncommon issues, health issues that she's been experiencing. Like she's all of a sudden sensitive to the sunlight. She cannot go outside, otherwise she'll get all rashes all over, or she'll be very sensitive to like different type of medicines that people like lidocaine, which people will usually say, well, not a lot of people would be allergic to it.
Hmm.
So we're like, well, before she was perfectly fine and healthy, how come now all of a sudden her health is starting to deteriorate? And as we are trying to get her seek out different doctors, no one was ever able to tell us like what exactly is the cause of this. It's kind of just prescribing medicines, telling you okay to avoid this, and doesn't solve the problem. So then that's why we started to search on different things of like what can we do on our side that's not answered by the doctors to help her with those things. And then we come across the biological or the functional side of the medicine field. And then that's when we say, okay, yeah, things do click. The idea of how the body functions as a whole, how we're bringing the nutrients into the body, how what we do to the body all combines together and leads into reactions that may not be so obvious at the moment, but down the road it will just begin to show up as the toxins begin to build up in the body. And that's how we just stumble into it. And then I begin to figure out more and more about these things. And we say, yeah, this is maybe the more proper way or a more better way to also look at the body and then treat the body as well.
Yeah, very cool. So what is biological dentistry?
So it's more of we focus on what exactly we do to the body and what kind of reaction the body would have. So like if we are drilling the tooth is not just a structure, it's a living organism. If we're touching it, it is going to have a reaction. Just like if we get a skin cut, there's going to be a reaction there. So for us is, well, when we're doing things, when we're doing the treatments, how can we minimize our influence on those on the body's reaction? How can we make the body feel like, okay, it's something that's okay to have and not having a long-term impact down the road? So the materials we put in, we need to know that, okay, it's not something that will be toxic to the body. Things that we recommend patient to use, that also needs to be something that their health or their body long run also accepts and not having any negative impact. Same thing with the treatments. So it's more of understanding the whole body and then designing the treatment based on the whole body and then proceed on forward with it.
Yep. Can you give an example of how you might do that?
Do you like the treatment wise? So
Yeah.
like a lot of times if like for instance like the filling material, we look at I read through the whole material list and say, okay, what could be in there? Is there some sort of BPA in there, or is there some sort of other toxins in there? And then I choose the cleaner one. And of course, there are patients with very strong sensitivity, where they have histories of their family doesn't respond well to certain like the numbing agents or anything that was used on them. Or they say, okay, every single time I go to a dentist, my body has some sort of reaction. Then we say, okay, we can do blood testing. We can see what materials out there actually have a reaction to your body. And then I look at the materials, I compare to my material list, and then we provide it from there. And also, it's like the techniques of how I drill the teeth. I will want to be as conservative as possible. If I can avoid crowning the tooth, I want to avoid that because, after all, if I'm taking away too much tooth structure, that might also influence the nervous system or the tooth nerve negatively as well. So it's all about trying to be as conservative, as minimally invasive as I can, and then look at the down the road.
Yeah, yeah. So we're on a show about brain health and wellness. So
Mhm.
what's the connection between the mouth, the brain, and the body?
Yeah, so basically, our mouth is the start of the digestive system. So whatever brings in also feeds us, in turn also feed our brain. So if there is pathogens in our mouth, if we're not looking at things under the like a micro under the microscope, not knowing what kind of pathological effect. For instance, for people with the gum disease, it's a whole set of different things that can be influencing them. It's not just, oh yeah, you have tartar, you have bacteria, so therefore you have gum disease. Because not all people with the same set of bacteria or the number of set of bacteria in their mouth that we know is problematic will have gum disease. So then we want to treat how to make sure that that is treated. That is also kind of how should I put it? So for people like having the gum disease, and we want to target that microscopically to make sure that okay, the bacteria are eliminated because we know that the bacteria that causes gum disease also leads to Alzheimer's, diabetes, joint problem, those kind of things are cardiovascular. So it's a lot of things that connect. So for the mouth and the brain and the body connection, it's kind of like a little universe. I'll put it that way. Our body is so every system is integrated with each other. So then that's why for the mouth part, yes, it does play an important role. Like the material we use, like fluoride that's used nowadays, very commonly being the cure indicator saying that okay, use fluoride prevents cavity. And we say, well, fluoride is so abundant out there nowadays because the water's fluoridated. We know that um, there's food that has naturally contains fluoride as well, and then there's toothpaste. There's fluoride varnish that people get every single time they go to the doctors, dentist. So is that too much? And we look at it and we say, yeah, it is too much. And the fluoride, we know that it can influence the pituitary gland in the brain. And then it can influence the thyroid. It influences IQ as well. So then we say, okay, so do we want to have that? So, and that's something that's very commonly people are using in their mouth. So you can see like how we introduce things can really have an effect onto the brain as well.
Yeah. At one point, I worked with a neurologist who he was
Mhm.
very big on almost like functional neurology, and I didn't really realize it at the time. And he would talk to patients about whether or not they had amalgam uh, uh, cavity fillings in their mouth, and having them go see someone to remove those amalgam fillings. What are your thoughts on that as a potential like toxin for the brain?
The amalgam fillings you were mentioning, right?
Yeah.
So it's the mercury portion of the silver filling that we're concerned about because the silver filling do release the mercury vapor whenever we're brushing, whenever we're eating, as the temperature rises in our mouth because our food usually are warmer than our body temperature.
Mhm.
Mercury vapor is being released. So when that's released, it enters our body, and mucosa is a very in our mouth is very it absorbs things
Mhm.
as we eat. So with the mercury vapor being absorbed that way, then of course our brain is very close to the mouth as well. So that then mercury is a neurotoxin as well. So then it's everything is gonna be influencing and then causes damages to the body and to the brain too. And yes, removing that, I would say long term wise, it's always better because we're having that released every single time that its amalgam filling is being touched, and that in the body is going to accumulate slowly over time. That level is just going to go up. So why? Why think about it? Why do you want to have something like that in the body consistently releasing the toxins? Versus if you take it out, yes, we know that there is that increase because we're touching it, we're drilling against it, we're creating heat around it. Yes, there will be an elevated amount of the mercury in the body for that time. We will be doing everything we can to protect the patient, and we'll doing everything that we can doing drilling to minimize that touch. But long term wise, I say, yeah, you have that increase, and then you detox
Mhm.
after the mercury removal, because mercury removal is one step, the first step of extracting that toxin out of the body. What happens after that? How do you take care of the body? How do you detox that? And the previously accumulated mercury level, how do you detox that out of the body? That's the after steps that we also need to have knowledge on and guiding the people or working with their naturopathic doctors to do that. And then that will slowly over time bring down to no more mercuries in the body. So I would say in the long run, that's better for the body than to keep it in the mouth,
Mhm.
for sure.
Mhm. Is it better to remove them before you start having problems?
I would say, yeah. So, because the body is, as I mentioned before, it's not something that right now you may not see it right away as it being put in. Some people are very sensitive, so even by putting it in, it tips them over the balance, so then their body just could not, or the threshold, so their body could not could not contain it down anymore. So they're having a lot of symptoms. Some people is down the road is because all the other things has been added onto their body, the stress level, the other traumas their body has undergone, the inflammation their body may be having, and then it's like adding each other, and then that addition of that mercury being consistently present and the level continue to go up tips them over. So I'll say, yeah, why wait until the damage is done, and not and let's try to do something that will prevent the problem down the road, relieve that one of that possible of risk of having the body not to be as healthy as before to happen. Why wait until then? Just take it out before the trauma, the damage.
If somebody has developed symptoms already, is it reversible at that point to take it out, or is it something that they're now potentially having chronic illnesses because it's been there?
I would say it's the chronic illness itself. There's so many factors that plays to it. But if we're talking about if we're just solely looking at like the brain fog that people may be having due to the mercury or the joint problem, those things usually people will begin to feel better and better
Mhm.
as we remove it out. Because that's a direct link. If that's a direct link from the mercury itself, yeah, of course, by removing the amalgam fillings, that will improve. But if the chronic problem they're experiencing, the health issue that they're experiencing, is on top of that mercury, then of course we're helping relieving the symptoms a little bit, helping the body to heal faster compared to dealing with that mercury level right there. But will it completely relieve that? No, because there's other factors that needs to be taken care of as well.
Yeah. Yeah. And kind of to wrap up on that, can any dentist remove those fillings, or does it need to be a biological dentist?
Well, of course, drilling and filling out, anybody can do it. Properly doing it, properly taking care of the body after doing it. That's I would say biological dentists will be the one to go for,
Yeah.
because there are a lot of the dentists out there that nowadays which is yeah you don't like the silver filling in your mouth, I'll just take it out, and yeah I'll make sure that everything is taken care of and there's no problem.
Mhm.
But then do they really understand the way that they're doing it? Is it proper? The way do they know how to take care of you after that? So that's why I would say it's better to have someone who has the understanding from the biological approach, from the cellular function level understanding to take care of it instead of yeah, just anyone.
Yeah, I was gonna say that was my understanding as well, is that you needed to make sure that you go to somebody who knows how to do it safely so that you don't have that rush of mercury into the body or minimize it as much as possible.
Yeah,
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 for sure.
yeah. What other benefits are there to being under the care of a biological or a functional dentist?
So there are a lot of things that we also watch out for. Mercury toxicity, fluoride toxicity, those are the things that's like a very base of all the things that we look at. If we're doing anything like tooth extraction, is it everything cleaned out properly? When the things are placed back in, are the things are are the things more not causing any kind of inflammatory reactions because different materials being placed back in from the bone graft. Usually, I would say, well, we understand the cellular function of the body, we understand the interaction between the different materials, then we want to use the material that will help the body to heal better. So, biological way of doing things, well, of course, we let the patient know about the idea of like, well, yeah, there are implants, there are things like dental treatments like root canal. What are the pros and cons of different implant material, and what are the pros and cons of the root canal, having a root canal treated tooth in your body? And then we say, well, our understanding is don't do this, don't do that. This will be better for the body down the long run. Then we tell them like the root canal, the tissue is dead. It doesn't have natural defense than a live living tooth would have. For your health, will that be excuse me, will that be something that will be good for you down the long run? Like people with already having like health issues, um, root canal because it's accumulating bacteria in the tooth because there are openings in the tooth structure, and those openings in comparison of the sizes, if you look at the bacterial size and you look at the dental tubule or the enamel tubule, those kind of sizes, the opening is bigger compared to bacteria. So of course bacteria goes in there. And then root canal treated tooth cannot flush those bacteria out so naturally. So with that accumulation, the body will recognize, hey, there's something wrong over here. It's not live anymore. It will have a response to it. So then, of course, and down the road, the body will react to it as like a low-grade inflammation. And there has been people getting different tests that already shown that their issue with the low-grade inflammation is pointing towards the tooth when they have a root canal in there. There are people when they extract the root canal treated tooth out and then they send it out to biopsy or to test it out to see what's in there. They'll see mold, they'll see different, like a whole load of bacteria in there. Those are the things that, hey, we have noticed. So then for us, it's, well, is there something that should be done? Is there something, because their mind and the body is also connected. So we say, okay, are you ready to move forward to it? Are you not? If you're not, then how do we help you alongside to monitor the root canal treated tooth? If you're ready, great. Then how do we treat the tooth and to make sure that all the bacterial things that are accumulated there for so long removed properly? And then we put something in there, is it something that will react to the body? Is it not? And then, of course, the metal interaction with the whole body, that's also something that we look out for. So it's a lot of things that biologically we have to look at in the body to make sure that everything is done in a healthier way.
Yeah, yeah. You mentioned Alzheimer's before. Are there other neurological
Mhm.
conditions you can see because of problems with dentistry?
Yeah, so Alzheimer's, that's one of, it's very commonly that we know of. The other ones, the Parkinson's also can increase the risk of that as well. So any kind of, because of the pathogenic bacteria in our mouth, they're so ready to hitchhike onto the bloodstreams. So down the road, it's a lot of the functions that can be interacted, like that can be negatively impacted,
Hmm.
yeah, in the body.
Hmm.
And if we say like yeah, like the dental materials again, yeah, those can also interact and of course hitting onto the different parts of the body and cause
Hmm.
things down the road. And there are unexplainable neural side effects that we know of, like the galvanic effect with the metals existing in the body.
Yeah.
There have been reports where people have unexplainable migraines, like saying, "Oh, it just I feel pain along my like right side or left side or whichever side." And then we say, "Okay, when does that happen? Is it something that we notice?" And then usually, if we take out the metals, they say, "Oh, that's better."
Hmm.
There are cases where people are saying that, oh, my eyes, sometimes I see like sporadic, just like little tingling sensation, or I see something like it's just there for a second. Oh, occasionally I see that I don't understand why I'm seeing that kind of like a little spark or something like that.
Mhm.
So then we say, okay, is there something else that could be happening in the mouth as well? And then we take it out, and then yeah, people will say, yeah, it's not bothering them the same way anymore.
Mhm.
It's like it's not that symptoms is not there.
Yeah,
Yeah.
fascinating. I don't think I've ever thought about teeth when I'm thinking about treating a migraine patient, but now I'm going to have to start thinking a little bit more about. about those things. Is it something that would show up shortly after getting those fillings, or is that kind of an individual thing that could be years down the road after they've had it?
I've had patients where after that's taken care of, they don't experience migraines
Okay.
as much as anymore. They sometimes with other things like stress, they'll still say that, oh yeah, my migraine come back, but it's not as bad as before. But has it improved? Yeah, I've seen people with improvement. Unless there are other issues like migraines can also be resulting from TMJ, which is also on the dentistry side of things. And then I'll take a look at that and tell them, well, naturally, what you can do to help relieving the tension that's built up over there. So yes, it's a little bit of a like again the multifactorial things that we're looking at to help with those kind of symptoms.
Mhm.
Yeah.
Yeah. Yeah.
So I have seen people improve. Yes, I have seen people with a little bit lingering. That may be other things that's also contributing to it.
Yeah, yeah. I think it's always fascinating to talk about these different topics because we always think about our body in silos in Western medicine, especially at least. So neurology, everybody focuses on the brain, but everything is related to the brain. And like you were mentioning, the teeth and the bloodstream, it all is interconnected. So when you end up with infection or inflammation in your mouth, it absolutely can affect your brain too. I think probably the most wild case I ever saw was somebody who ended up with a meningitis type of presentation who it all stemmed
Mhm.
from an oral infection that they had.
Ah, yes.
Right.
Yeah.
So, yeah, so you can see some crazy stuff that shows how
Yeah.
interconnected the body is, and we really can't stick in the silos when we do that.
Yeah, sometimes the sinus infection can also be resulting from the mouth as well, or the sinus pressure. So, yeah, it's
Yeah,
definitely.
yeah, yep. Uh, what are, I guess, do you have any like weird things that you've seen that just kind of blew your mind that were related to oral care or biological dentistry in general?
Okay, so there are things that I've expected. There are things that I have not. So talking about the sinus, because I just mentioned about that. There's a patient of mine, or a few patients of mine, that they have chronic sinus problems. And then when I took out the root canal treated tooth on the upper,
Mhm.
and then that's like a direct linkage between the sinus and that tooth. So when I took it out, immediately there's a very strong smell
Hmm.
from it. So then I know like, okay, yeah, this tooth is definitely something has been building there for so long that it's influencing their sinus. And I have a patient that says that, oh yeah, after the tooth was extracted, several days after that, sinus is clear.
Mhm.
Yeah. So then it's not like clear immediately, but then they're seeing like an improvement, say, okay, yeah, it's getting better and better and better. Yeah. So and then eventually cleared out. But I have seen that happen before, and
Mhm.
have seen other people where they say, okay, yeah, I have a tension on the right side of the body, and then after I took out the root canal tooth as well, and they say, okay, yeah, I can feel that tension is being relieved. They can't really explain like, but then they say that I can really just feel that everything start flowing in that area, the stagnation that they cannot describe, like that kind of things that are not moving well in that side
Mhm.
is flowing again. So yeah.
Hmm. Crazy, crazy. Whatever happened with your wife? Did you figure out what was going on related to her teeth?
To her teeth, yes. So there were mercury, of course, in her teeth, and
Yeah.
we removed it. So her sensitivity to sunlight has improved a lot. Not completely cured yet, but we're trying to figure out like what's the remaining, what's the remaining things that could be contributing to that. But lidocaine, that kind of allergy she has, we just never had her try it again. And
Yeah.
lidocaine itself, there's other studies with all the things that people are talking about, and then we don't even use that anymore. So then for her, it's yeah, it's always trying to avoid lidocaine, but it's something that's also commonly practiced as well. So
Yeah. Yeah.
it's a little bit challenge for her.
Absolutely. Absolutely. Are there people who should seek out a biological dentist if they have never had that experience and they might be having problems? So anybody listening that you would recommend if they're experiencing certain things that they should seek out somebody like you?
So I would say it will be best to be for everybody to be under care of the biological dentist, but for especially for people who have a lot of one allergy, two is that weaker system that they know they're constantly getting their chronic fatigueness that they're experiencing, or they're constantly getting sick out of no reason that they wasn't like that before, or they have digestion problems because there are dental things that like mercury can also influence digestive system. So well, so for those people, I would say, or people with mastocytic constriction syndromes, or people with uh, like thyroid problems, have someone who really understand the effect that what happens in mouth can have into the body. That would be a good way to take care of their body. That will be it will be beneficial for them to be under care of someone who understand those influences and will want to look at things very detailedly on the cellular level and try to help the body heal and recover from the things that they're suffering from.
Mhm. And then are there any kind of misconceptions about dentistry that you hear a lot that might be good to share with listeners?
As in general dentistry or the biological?
Biological, we'll focus on your, yeah, yeah.
Yeah. So a lot of things like because you know how it's so commonly practiced with the fluoride, the mercury. So people like these kind of base things when we start with these and then we talk about other things. But then with these two things introducing to the if you, it's the topic of the public discussions, you'll notice people will be like, "What the heck are you guys doing over there? Why are you recommending this? Why are you telling people not to do this? They're having cavities. You need to treat the cavities, get them cavity free, and then fluoride works. So what are you talking about?" We understand all those things, but we want to treat the body naturally. So it's not like we're doing some woo-woo or the negative things to the body. We're trying to heal it naturally and natural way versus a band-aid way. It's band-aid will always make things look better immediately. But then we're focusing on, well, we don't just want to treat the symptoms, we want to treat the long-term effect of it. So yes, it may not be making a lot of sense why we're doing certain things this way and that way, but then we're basing off of what we have seen in the smaller set of the population where they're just not responding well because they have that immediate reaction or the very fast reaction compared to the rest of the public that they have. So then we are treating it in a science-based way and then in an understanding in a research way as well, in comparison to well, just go in there and drill and fill and then go in there and then here's the medicine for it. Go for it. But we want to know like why are you having this? So it's that's the misconception a lot of people will have thinking that we're not treating it properly.
Yeah. Yeah, that's what I love about functional medicine in general. Any aspect of functional medicine, whether it be dentistry or the medical side or neurological side of things, is that it always is looking for the why rather than just putting band-aids on it.
Mhm.
And there is a lot of research behind it, and people just don't realize it because it's not
Yeah,
typically mainstream. So
exactly.
yeah, yeah. So how can people find you to get more information? How might they find a biological dentist in their area?
So there are us who are around the states, of course, not many, not like very popular out there,
Hmm.
like the conventional dentistry. But for me specifically, I practice in Seattle. So if you just go onto the website seattledentalcare.com, there will be things that we talk about with what we do, and then a little bit introduce a little bit of the different blogs talking about what's the biological things, what our approach, and how we look at things. So those are the yeah some ways to find me and know more about the biological stuff.
Awesome. And I saw you shared a Facebook and Instagram as well, and I will
Oh yes.
include those in the show notes so people can find you easily there.
Mhm.
Any last words of wisdom you'd like to share with our listeners before we wrap up today?
So I'll probably say just always try to seek out the deeper answer and not stop. Don't stop at the very top layer of things. Try to find out the root cause.
Yeah, yeah, yeah. Tongue in cheek on that one, root cause. Yeah. So yeah,
Yeah.
that's my words of advice all the time too, is look for the why and keep looking because there will be an answer somewhere. So awesome.
Yes.
Awesome way to end the show. Thank you so much for being here today, Dr. Zhao.
Thank you for having me.
Yes. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.